right, members of the public wishing to participate in this meeting must use their full name for Zoom access. As a preliminary matter, this is Veronica Volchik, Chair of the Council for Human Services. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. So we have Sue Minthinen. Can't hear you.
Hear me?
That was weird.
Tara Restieri,
And Sarah's here.
Here.
Kelly Steffen,
Here.
and Suzanne Keating,
Here.
Amanda Wright,
Here.
and Veronica Volchik here. I believe I got all members. Oh, and Sarah Wright just joined us also.
Sarah, yes.
Hi, everyone.
Thank you. All right. Staff, when I call your name, please respond in the affirmative. Jericho Melee
In attendance.
and Tamika Gary.
Here.
Okay, thank you. My dyslexia is coming through today. Anticipated speakers on the agenda, please respond in the affirmative. And we have Rosemary McLaughlin. Good, thank you. Good afternoon. This is the open public meeting of the Council for Human Services. It's being conducted in a hybrid fashion according to Chapter 20 of Acts of 2021. Ensuring public access does not ensure public participation unless participation is required by law. This meeting will not feature public comment, but we do have a guest today with us. For this meeting, it's being convened by video conference as posted on the town site, which identifies how people can join in. Please note that this meeting is being recorded, that all attendees are participating by video conference. Any vote will be done by roll call. All right, so if going to the agenda, we've just established we do have quorum. Second item, public comment. With no public comment, what I do realize that is not on the agenda, we do have to have an approval of the agenda. So can I have a motion? Approve the agenda?
Motion to approve.
Okay, Tara,
Second.
Kelly second, thank you. By roll call, Sue Minthinen,
Aye.
Tara Restieri,
Yes.
Kelly Steffen,
Yes.
Sarah Wright,
Aye.
Amanda Wright,
Aye.
Suzanne Keating,
Aye.
and Veronica Volchik, aye. All right. So from here, we're going to jump right into our spotlight on community organizations. And we have invited Rosemary McLaughlin of the Community Solutions for Behavioral Health. Rosemary, thank you for joining us today. I know that we had a chance to meet personally, probably about 2 months ago at this point, and I was just very excited about having the opportunity to learn about what you are doing, and being that it is Behavioral Health Month, we thought that it would be a good opportunity to have you introduce yourself and the organization to our committee and to the public via this meeting. So thank you, and take the floor.
Okay, thanks, Veronica, and thanks to everybody here for the invite, and I will get right to it a little bit, tell you my history of how I got here to this island, and roll into community solutions for behavioral health. So my past professional experience really was in Eastern Mass before moving to the Berkshires in 2015. And I've worked in post-acute care settings, in education, operations, and quality. And moved here when someone I know started working at the hospital just over a year ago. And so that's how I came to be on Nantucket, and then worked in that past job until Community Solutions for Behavioral Health hired me as executive director, which I started in October. So Community Solutions for Behavioral Health is really a kind of evolution of task force, behavioral health initiatives, behavioral health advisory groups that have existed on Nantucket for 10 to 15 years and did well, but didn't quite make enough difference or a difference in the ways desired to improve systematically behavioral health on Nantucket. And when I talk about behavioral health in this context, it's both mental illness or mental health as well as substance use and substance misuse. So the community health behavioral health assessment was completed in October of 2021 for Nantucket. And then what is now the board really took a year to look at that in depth and then determined in order to actually gain traction and make some real differences, a separate entity was needed to really focus on this. And that's kind of, again, how I ended up here. So our mission is to facilitate collaboration amongst the nonprofits or for-profits, I guess, but the providers in this area for a more interconnected system in regards to prevention, intervention, treatment, and recovery that helps the community get and stay well. So it is across that spectrum of care, if you will. And again, it's a systematic level. So this isn't about programming. This isn't about going to take money from the town for grant funding. It's maybe looking at this strategically so that the nonprofits that exist can systematically approach the problems and the gaps, right? So I work very closely with Amanda Wright. I work with the hospital and Sarah Wright. The board includes the Community Foundation, the hospital, and Fairwinds. The school superintendent, Jericho, is on the board. Some other community stakeholders are on the board. And I'll take a deep breath for a second. If anyone has questions along the way, please interrupt.
I have a quick question.
Sure.
How often is the evaluation done? Is it mandated or is it just by choice? You said that you did the survey in 2021.
The community behavioral health assessment, I do
Yeah.
not believe is mandated.
Okay.
The hospital does a community assessment, which includes some behavioral health questions.
Yeah.
And one of those is being done now. That is required. This one might be a little ahead of schedule, and maybe Sarah can help us, but I think it's required every 3 years. Every 3 years, the hospital has to do that.
Yeah. Is
Yeah.
that a JCHO requirement or is it something else?
It's JACO or the public health.
Yeah. Okay. Thank you.
Sure.
I mean, the original assessment was done, it was Fairwinds, and I think the hospital was involved.
The gap study. Yeah.
And they did a gap study. We hired a company called Government Performance Solutions that came in and did a whole evaluation and gave us a lot of data that was new and interesting and some that we already knew.
Yeah.
And that document, that study,
2021.
that study is included on the town website. It's on the
Yeah.
Community Solutions for Behavioral Health website. It's pretty well published, I guess. So there's a lot of gaps there, right? For sure, that were identified. So since I started, that's kind of what I've looked at, right? So access, right? So that's a big topic. I've met with probably going on 60 or so individuals, maybe more. And I just tried to do a little count, about 40 different agencies and organizations. So why that's important is that on Nantucket, we sometimes think these services don't exist or we don't have access to them. So facilitating that mainland agencies who have and island, right, tagged on are providing the services, or state, the Department of Mental Health agencies are actually doing what they're supposed to do in providing services to our residents. So those are some examples, right? Working with Department of Mental Health, they came out, did a training, they have a close relationship with Fairwinds, but they gave a education session to 25 providers on island about how it works and what they do. And those are just helpful things, right? So you know who to call when you have a need, you know who to reach out to. And there is some of that if you're not seen Like, you know, people kind of just don't remember how it works and what the value of those services are. So there's been various projects like that that I've worked on so far. Another big one is grant funding, meaning making sure organizations know the funding available, know to apply, and how can it be done strategically, right? So that doesn't, should we have a guest speaker or an event? Sure. Those are fine things to do, but in the bigger picture, how does that fit into a more systematic approach to meet these gaps that have been identified, right? So again, in a pretty short period of time, I've helped NAMI, Cape Cod and Islands apply for a grant. They'll find out in June if they got it. I'm actively working with Addiction Solutions on a really, this is opioid remediation funds. So that grant was just released mid-May with a deadline of mid-June. And so that can be used for operational capacity, right? Expanding and identifying their outreach. And it's a very different grant because it can be used for operations. So I've met with them a couple times. They're very enthusiastic. I'll be able to review before they submit and work with them on that. So those are just a couple of examples of the work I'm able to do, again, to help all of Nantucket, right? If we have a better and stronger agencies, the community will be healthier.
Thank you.
Sure.
Okay, question?
How do we, with the not the council, but so the Jericho's umbrella, I guess, of human services, there's a lot, how do we interface with behavioral health? I mean, we must have a lot of overlap.
So, and Rosemary, there's a little perspective I can add from previous to when you started with CSBH. So one of the things that we found when we were going through the GAP study is that there are a lot of different stakeholders, but there was no overarching connection between all of them.
Right.
And the solution that came about through that behavioral health initiative was to have basically have CSBH as sort of the people whose job it was to look at the whole system as opposed to any of the individual parts.
Oh.
With human service, so Rosemary and I meet basically every other week, and we're on, along with Amanda, like a couple meetings a week, a couple work groups a week. And what is the case now is that the Human Services Department for the town of Nantucket has several taxonomies that they classify human services needs. It's senior and elderly affairs, behavioral health, there's veterans affairs, there's youth affairs, there's a couple of other sectors. Behavioral health kind of cuts across all of it.
Yeah.
Everything can be a behavioral health problem. So one of the things is that it's sort of the specialist in behavioral health will have more knowledge of that particular area, and so acts as like the person who's monitoring a lot of those things and coordinating between different agencies, because everyone who works for a different agency has their day job that they have to do of tasks to get accomplished. So what Rosemary's organization does is the backbone connecting all of those different agencies and making sure that we have effective communication and that we kind of are I mean, I guess like all working, like all rowing in the same direction at the same time, basically. For resident interface, Rosemary has just been instrumental in me finally getting the network of care directory service up and running, which means that for residents, it's going to be the digital book of I need this and this connects through it. We're starting in behavioral health because I think the most acute need across all of the sectors that are under my umbrella is behavioral health right now. It's the most pressing one in terms of acute crisis. It's the most pressing one in terms of its systemic effects on the wellness and general health of people on the island. And it's one of the three big public health issues on Nantucket alongside skin cancer, tick-borne illness, and behavioral health, including substance abuse. Substance misuse. So Rosemary kind of helps us connect together on it and serves as a kind of neutral advocate with sufficient time and resources to focus on behavioral health. Did that answer your question?
It does.
Okay.
So like an example on that is that the network of care, so one of my tasks, I guess, from the get-go was kind of, and I experienced this, right? So I show up for something and I'm like, there is a lot going on here, but people don't know what's going on, meaning the other nonprofits as well as consumers in the community. So network of care has a calendar function, right? So we can populate, or the organizations can populate that. So I've been working a fair amount on that project recently, actually, as Jericho knows. And it's kind of been a chicken and egg in terms of how do you get started on that, but we have gotten started. And within the next week or so, organizations will get the link to say, add your calendar events in here. And again, I'm sure it'll take a little time to get traction, but the organizations are aware of this coming due to other conversations. And when you see towns and states using that site, it's a beautiful thing to say, I need a support group. Here's all the support groups listed on a calendar. You know, I want where's my food pantry? Where's my counseling? Whatever it is, if they, one as a resource for the agency, but also as these calendar events that are happening.
Rosemary, that is not live at this point at all,
It's
is. Oh, sorry.
it's live, but it's not filled really.
populated.
Events, right, it's not populated yet.
And the I assume that it's an app or a website?
It's a town affiliated website network of, well, accares.net is
Okay, so
actually the site.
ACKcares.net.
That is correct. So
Oh.
the organizations are in there. I've just made a lot of edits to that, which Jericho and I are reviewing tomorrow. It was populated in 2022, but really not so much updated. So we're gonna finalize that update. We'll send it to the software manager who will put in those edits, so to speak, and then we'll get out to have organizations self-populate the calendar. So that's key too, because it's sustainable if we can stay on these organizations to populate it, as opposed to Jericho, Wright, or myself trying to do that seems far less likely.
Thank you.
Sure.
Be doing some network of care and ACT cares related stuff during my update too, so.
Okay, thank you. Any other questions for Rosemary? I have one question. When you were talking about coordination with all of the agencies and trying not to have overlap, I assume that the result of that will be on ACKcares.net, that we can see, you know, what's happening. So there's not, say, the same speaker coming with two organizations so we'll see the result of that. But how are you going to achieve pulling this all together and having a coordination?
Yeah, I think that's a little bit to be decided, but I'm working on it. There used to be a behavioral health advisory group with Sue knows about, and getting that website kind of so that's an inactive group, right? It's not been active since 2021. So transitioning that to the CSBH website, and I have a pretty good contact list going. I also attend the Healthy Collaborative Luncheon with the foundation. So that's really the outreach kind of network method. And then we will meet from there as to the best ways. The tricky part too is that you have non-behavioral health organizations who do some of this work, right? The Dreamland, I have connected with them, right? They have a project going on right now and had some great events the past month. Or even the Artist Association, I've connected with them. I've talked to Tracy, right? So by being present and reaching out a lot, I'm able to kind of get started. And that is what needs to happen, Veronica, for sure, is that people are aware of what's happening. So my goal would be we meet ahead of time. Okay, what are your plans, or at least bigger plans for the next quarter, the next 6 months? And maybe you don't know them, but at least you might know, okay, well, someone else is going to have Chris Herron here or something like that, right? So you're not overlapping. It doesn't help you. I've met with the schools a couple times and really am making some good traction there, trying to help them get what they need rather than just what people want to give them. Right? It should be based on their needs. They are the experts in the schools and with the children, and let's see what they need. So that's going along also.
Well, I'm very excited to hear all of this, but I also understand that this is a tremendous task. And even though I think that, we're 20 some odd thousand year-round people, plus our population expands, that we're a finite, population, just coordinating what's happening here has to be a Herculean task. So, best of luck. And
I'm ready. I'm up for it.
okay. And I think that, just thinking of the outreach you're doing with actcares.net is touch points for all these organizations. And once you get that communication going, it's just limitless in what could happen. So
Agreed. Thank you.
best of luck.
Okay.
All right. Anything else? All right. Well, thank you very, very much. Appreciate it. And you really made it very concise. So we appreciate that today.
Okay, I
Thank
was trying, and anytime our questions come up along the way, Jericho and Veronica and others here know how to get a hold of me. So don't hold back if you just have a question or want to learn more. I appreciate it.
Thank you. All
Thank
righty.
Thank you.
Have a wonderful weekend.
You too.
All right. Actually, before we go on, I have a question for Sarah Wright. And it's just, this is for your hospital hat. And it's just something that has come across, and recently with doctor's appointments I've had. I've been asked, in a survey, some what I consider behavioral health questions. Is that the effort that you're doing, or is that potentially because I am also a senior citizen? And is that coming from requirements from Medicare potentially? But I've every time I'm asked, I sort of like, I say, oh, well, that's wonderful. And that it's a way of sort of finding what's happening without asking someone, are you okay today? So,
yeah, no, that's a good question. That's a really good question. I think there are two things that are going on right now. So one is a pilot that we're doing along with, I think it's Cooley Dickinson and Faulkner Hospital, but that's ED only, and it's registration. So it's self-registration.
mhm.
And that's part of that is just to gather a little more info, where in the past we've asked people verbally at the desk some of these same questions. So you have more privacy when you can answer those yourself like this
Right.
through the portal. And then we have we are as part of the health quality equity incentive payment program, Mass Health Program. I call it HQIP, like, NSQIP, the National Surgical Survey. Anyway, it's HQEIP, Health Quality Equity Incentive Payment Program. And that is a whole other set of questions. And those questions relate to what everyone refers to as social determinants of health. So those are, you know, food security, housing security, or, you know, the other side of it, insecurity, lack thereof, transportation issues. There are these other demographic questions that HQIP also is trying to, you know, gather the same information. So language access or language needs, spoken, written, and then just population, true demographic information. So some of those, there have been additional questions. So the ones that we're all used to, you know, race, ethnicity, marital status, and sexual orientation, gender identity, all of that stuff. So they're coming from a couple of different places, Valerie, and for different but related reasons. And in both cases, we're trying to make sure that there's, I think, a modicum of a little greater privacy, because some of them are, some people consider them sensitive questions. Personally, I do not, but, you know, and some of the answers are matters of public record, you know, like, are you married, are you not? Things of that nature. But, you know, if you're someone who just, you know, became widowed or something, you know, like, you might not want to have to answer that on the spot when you're checking in for whatever. And I appreciate that. So I hope that answers your question.
Yes, it does. And then a follow-up on that is what happens with the results of the survey? And I guess I'm honing in on food insecurity question. That if someone on that survey says, gee, you know, like, I don't have enough food, what happens to that information? Knowing that we do have services on the island that person can tap into.
Yes, excellent question. So the answer to that question could be, you know, a dissertation, but I'll keep it
Right.
simple. So I think, again, Mass Health, right, is trying to understand like where's the greatest need. And if you read reports this week, you saw that Nantucket was in the news relative to SNAP benefits. So we and Dukes County, and I forget where a couple other places across the country, there's a huge gap between the average SNAP benefit and what's considered a moderately priced meal here. It's like a 70% gap on Nantucket. So that's obviously problematic. But, you know, I had someone in my office earlier today for food insecurity, and we addressed that. Patient also had to go to the ER, so that's in progress. But in any case, we refer people to the food pantry, right? We help people with SNAP applications. I do that all the time. And I'm also part of a group through the health system, community health, nutrition equity, the whole rest of it. And so we're having, you know, lots of cool, getting lots of great information every other week about these different entities that I think could help us here on Nantucket. I am due to provide some updated information to Brickmore and the resource partnership. And the questions that have been asked there, it's taken me longer than I would have liked to answer them, but that's because the answers to those questions lie during the time that predates my being here, and also in the middle of the pandemic when, you know, the public health emergency kind of guaranteed some, you know, there was a stronger social safety net at the time because of the emergency. So I do think that all of these health related social needs screenings are, you're seeing them everywhere, and that makes sense to me, but I appreciate what I think you're getting at, which is, are people just checking off a box? The answer is no, we're not just checking off a box, but, you know, it's like any data collection. It's only as good as, you know, if you use it and how well you use it. So.
Well, I appreciate that response, and I didn't mean to put you on a spot because, you know, but, I knew that you're the holder of this information, so I appreciate that very much, but, I think it's a wonderful thing, and whether it is for a, congregate type collection or for individual use, it all, will get used properly, I'm sure.
Yeah, I'm hopeful. And of course, you know, some of it is, I don't know if it's a coincidence, but I think obviously the population here kind of, you know, increases a lot starting right around now. So I do think that puts some additional strain on everyone who's here at this meeting and your organizations, including obviously the hospital.
Yes. Thank you. Well, best of luck with the onslaught is coming. That's for sure.
Right back at you.
Thank you. Shall we move on to the next agenda, which is Jericho?
Yes, you guys get to hear me talk more, which is exciting for me too. Anyway, so things that I've been working on lately, we are still in the midst of the contract review committee review process. We should be getting an update on that from the consultants at this particular meeting on the 13th of June, which will likely be a preliminary discussion, which will have plenty of like, what's what I'm looking for here, space for you guys to ask specific questions, but I don't know that it will be fully at the recommendation stage yet. So the 13th, that actually is brings something up that we should mention at the end, just to confirm on the date change. We can do that in other business, I think. So that is underway. In addition to that, I've been working with Sharing Kindness and one of their subcontractors to do a variety of gatekeeping trainings, which is sort of like the QPR mental health first aid approach. We're at the stage now where we're trying to deliver QPR and trauma-informed care classes directly to either service providers or service or behavioral health crisis adjacent organizations. The Artists Association got a full QPR training, and we're going to try and get trauma-informed care in there. There's some other resources that we're trying to work out together under the Strategic Plan Alliance, the Strategic Plan umbrella, which is a series of basically startup projects, more or less, under a couple of pre-identified strategic goals. I happen to be in charge of the healthy and vibrant community area. So the 2 points that I'm working on are improved access to existing resources, consolidating resources, and improving outreach at hard to access demographics like the elderly or non-majority language speakers, which are resistant to a lot of the normal messaging techniques we use. More specifically, I'm going to work with Amanda to try and get a variety of different QPR trainers trained up on Nantucket so that we have a, for lack of a better term, domestic domestic trainer force. And I'm hoping to work out some interesting and novel financial systems to improve licensure and education for a variety of people in behavioral health tasks. We're also going to be kind of extending out the last fall and winter's consistent behavioral health education opportunities. So into the fall, we'll have monthly QPRs. I'll be looking for new places to deliver it. We'll have, I mean, I think the postvention group that Amanda and a couple of other people around here are, and Rosemary actually, we're working on, have a variety of speaking events. We're trying to tie together a couple of different themes, more or less, to have consistent behavioral health related programming going on at all times. And that kind of coordinate between everyone who's doing the outreach, the education, so that there's no gap in terms of what's available and what people know is available. And so we can figure out what other needs there are and how to get them here. There's been some work on the youth homelessness issue that arose a couple of months ago. Amanda, Rosemary, some primaries from our house, the community fund, and then it was Department of Mental Health, and then
School.
have been working together to open up a youth access center here and establish a host program for between 3 to 12 month stays for youth who are affected by homelessness, as well as a variety of sort of vocational and wellness programming they can get connected to. That's something that I'm very excited to see happen, and something that I think is a problem that we're going to uncover the scale of as we go along. Additionally, boy, what else have we got going? Outside of the direct behavioral health area, where I'm working alongside the Nantucket Center for Elder Affairs to improve our outreach to the elderly community and increase programming available for them. We're going to try and increase the size and availability of programming at the Salt Marsh Senior Center. That's actually been coming along really well. Both NCEA, the Nantucket Center for Elder Affairs, and the Salt Marsh staff down there have got a bunch more stuff going on. And then we're getting ready to try and sort out fall's COVID and flu vaccine process. We are currently in the pipeline for the state's mobile clinics that we've been hosting for the last couple of years. Those should start up again as soon as the sign-up sheet goes up for that for us. We'll be signing up for those on a monthly basis. And then hopefully we'll have all of those also be flu clinics as well, which is a possibility this fall. So we should have more vaccines of both flu and COVID available for this coming fall. That's most of it. Oh, the network of care updates. So network of care is a nationwide umbrella of websites that are human service related. We're going to brand it as ACT Care here, or ACT Cares, because the default website name for that is about 45 characters long and has 3 or 4 hyphens and is not easy to find. So we're going to be doing a lot of work on the calendar there. We're going to be trying to centralize a lot of human services messaging either through the ACT Cares webpage or through a combination of social media and improved kind of press release and communication. Actually, I'm going to try and have all of our grant announcements be centralized on that ACT Care page so that we're getting everything behavioral health related on one spot. And then we're going to try and we'll be implementing the CRC revision process with this year, alongside some changes that are coming down the pipe from finance when it comes to procurement, like the various procurement software we need to use. So yeah, it's going to be a busy summer, fall. We're also hopefully going to have another health director soon, and then get staff back up with our community health nursing program, which is doing a lot of directed observed therapies. We're doing a lot of public check-ins. We've got some nurses embedded in our house and the Salt Marsh Senior Center, and we're going to try and do more public outreach along that line. But yeah, that's it. Any questions on that big old paragraph or 4?
I have a question.
Sure.
QPR, of course, I know what that is,
Mhm.
but trauma-informed care.
So honestly, Amanda is probably better qualified to specifically talk about what trauma-informed care is. From Bree, who's been in the QPR training, it's a specific set of education around people who have trauma and how to approach interactions with them. I past that, I don't want to speculate too much because I'm still figuring out exactly what the program Bree has to offer is. But like,
I don't know what the program that Bree has is, so I don't
Yeah.
want to speak on that.
yeah, that's sort of where I'm at too. But in general, like trauma-informed care is just approaching interactions with people with the knowledge and understanding that they have experienced trauma.
Okay, so is it another program like QPR, so a training like QPR?
Yeah, I mean, again, I don't know what, Bree is really, I mean, QPR is really more around the education and prevention around suicide.
Right.
And when, people mention certain things, what are the questions that you can ask, and more importantly, how do you get them the help?
Mhm. Right,
That's
The goal really is to get everyone trained in QPR.
yeah.
okay.
And then the
Yes,
trauma,
I mean, in my experience is every time we've done a QPR training, there's people that have reached out to Crisis just for support. Cause it triggers something and they're like, oh, I'm worried about this person or I'm experiencing this.
and there's pretty good peer-reviewed evidence that prevalence of QPR education is associated with increased calls to crisis and reduced rates of certain behavioral health crises, including suicide. It's, to my knowledge, the only population level, like the only general systemic way to address that. It's similar, and it's analogous to a vaccination, but for mental health, or at least CPR and the Heimlich is. Trauma-informed care is going to be only delivered to specific people for whom their either service provision or clientele would
Okay.
need it. So Warming Place, for example, or a couple of other similar locations.
Okay. On the QPR training, will they be taking place during the summer?
No, unfortunately, it's gonna be too busy to do that, both the provider side, and then because we don't have we don't have a consistent local trainer situation ironed out, it's going to be paused primarily for the summertime. The other component is that we need to make sure that we're training people who are gonna be here all winter. Offering trainings in the summertime gives us significantly less awareness of what the number of people in the local communities.
So you're referring to almost like the train the trainer model with QPR then?
Yes.
All right, so yes, I can understand you want people that are gonna be able to be doing that year round. But as far as actual trainings for public, that also will not take place during the summer?
The logistics and complexity of doing anything like that in the summer, so we've been doing those trainings in the public safety room, the
Right.
public safety building. Their staff doubles or triples over the course of the summer. There's a ton of CSOs that come in. They're doing lots of more training, and so we're significantly constrained in when we can hold it and when the availability is.
Okay.
Oh, yeah,
Someone
sorry,
just said
same
that,
way.
it's like, we're still here, just sitting in the dark.
I mean, the great thing is I have 3 people that are actually lost survivors who've lost loved ones to suicide who are interested in doing the train the trainer program.
Great.
And then looking for some other people, that speak English, Spanish and Portuguese,
Mhm.
so they could be trained as well, because we want to be able to target those individuals in the community.
And that's the big gap that we have right now is non-majority language trainings and outreach.
And is that under the QPO?
It's question, persuade, refer.
But that's under their the suicide training.
Yes.
that you're
Mhm.
talking about, yeah.
So the umbrella term for all of this is gatekeeping trainings. The specific brand of gatekeeping training that we're using and the one that has the most specific evidential backup for it is QPR, which was intentionally designed to be like CPR, but for behavioral health.
Yeah, and then the
Tell me
schools
what
that,
those 3 words mean again.
question, PR is question,
Yep.
persuade,
Oh,
and
persuade.
refer.
Okay.
And then the schools, they do SOS, which is signs of suicide.
Yeah.
Which is more tailored towards, different ages, and they tend to do it to the high schools.
Did any of you get to go to the Dreamland presentations?
Theater of War?
Thursday, Theater of War.
I did not manage to make it.
I went to both. And,
Okay.
there was a gentleman on the panel who spoke about his son being, no. God,
I thought they were great.
they were fantastic.
Yeah.
Yeah, especially Thursday night.
I know we have, along with the Department of Mental Health and a couple other people locally, we have the postvention group, which is meeting on a regular basis. And part of what we're trying to do is connect all of these different events so that there's a smooth ride, more or less, for all of this type of material, that everyone knows what other people are doing in this field, because we really quickly found out during the behavioral health initiative and then the early stages of community solutions, we found out that there was a lot more going on here than was effectively communicated to everyone. And that gap study, the GPS gap study that Rosemary was referring to earlier, that identified the siloed nature of all of the different. So at one point, one of the major changes that's come about in Nantucket's behavioral health system over the last year or two is that there is a single place that you call when you have crisis.
Mhm.
Previously, it was split amongst 3 different agencies, and you needed to know things like your insurance status when you were calling with a behavioral health crisis. So things like that, where we're centralizing and being able to figure out where all the moving parts are, how they mesh together, and where we need to squirt oil to make the machine work a little better, is kind of what the approach in that field is. And we're like the amount before and after the CSBH formation, like the amount of time I spend working on behavioral health stuff directly with Fairwinds or directly with other agencies is vastly increased. We have a existing network and relationship of people working on behavioral health that is much less siloed and genuinely collaborative in a way that it wasn't when there was more of a, we have to make sure that the grant funding for, like, we can't, it's gotten way more integrated. There's way more collaboration and communication. And then we're centralizing things in places where it's easy to find. And then we're making sure that local resources are in the forefront. And that if we don't have something here, we know the people who are in need on Nantucket can be connected with those off-island resources in a much better way than maybe calling a state office somewhere and trying to figure it out. Just anecdotally, the interpersonal networks on this are so incredibly important. When you're having something like a crisis, or you're dealing with behavioral health, you want to be able to pick up the phone and know who you're calling and know what they have to offer you, because you don't have, like, it's a lot of work going on. And that has gotten much better. There's vastly more communication directly as a result of all the working together in the CSBH.
As part of all this, is there a communication outreach that is going to be part of this? So if there is going to be any type of a QPR training or any kind of a program that the public knows, and I know that actcares.net is going to be part of that, but you're going to have to go to that to find the information as opposed to advertising somewhere.
I mean, that's one of the things that we have spoken about, is that the need to get the word out to everybody. I think what the challenge is that, there's a lot of organizations, and I think the important thing is that we are, like, everyone's posted on their social media and their, like, website. The town does it, Safe Place does it. I mean, we need to spread the word more, because I think the feedback I've heard is that, oh, I just found out about it today, I couldn't go. And I think there's a lot of people that want to be trained in this, and I think we just have to, we talked about that the other day, so we have to do a better job at, sending out the message in different places like the Inky and the Current. And, I mean, that's the key, is to get the message out. And I think sometimes, when we used to do the QPR presentations, I mean, it was helpful when the employers posted it and paid for the time, because it encouraged people to come. But I think, speaking to what you're sharing, I mean, in this summer, we see an influx of crisis. We had 3 suicides last June, and it's really important to get the word out. And, my hope is that next summer we have trainers that are able to do one every month, so people in the community that come here are able to get the support and learn the questions to ask.
So I am publicly committed to having at least one open to the public QPR training every month from September to May. That's going to be, I don't care if nobody shows up. That is going to be for next fiscal year, that is going to be built into my repeating budget. It's not going to require grants. It's going to be a specific request to deal with a specific persistent public health crisis on the island. So there will be at least one public QPR training every single month. One of the things that I found when I was doing clinic work, and this is, unfortunately, I started during the COVID, so everything is a clinic to me, is that you need to establish an expectation that it will be available, so people have it in their head that they're going to have it going. And then you need to bring it to them, in addition to having the publicly open one. So I basically look at the regularly scheduled ones as being a loss leader. They are in and of self a statement that there's a commitment from the town to address this problem, and to do so in a consistent fashion, regardless, because for whatever reason, and I'm gonna hammer this home for the rest of my time in the town, we have 3 public health problems on Nantucket, and one of those is behavioral health, and we message it the exact same as we do ticks and sunburn. That's it.
And will these monthly trainings be open to or offered to the fire department, the police, EMTs?
Always.
That was another discussion. I meet with fire and police and dispatch monthly because of crisis. And my hope is to work with them to have them all, get the training as well. And, September is suicide prevention month, so I really hope that we can
We'll
get
have something
people
going.
trained so we can do a community-wide QPR presentation. And I've shared with Jericho that Fairwinds and Crisis is, we're more than happy to be at each of these trainings. So we can just answer questions, be of support to someone if it's triggers for them, and also just educate them about what are the resources on the island and when you leave the island to get help.
I was thinking it's really important because they're often first on the scene for any
So
events.
there's a reason why we did the trainings in the public safety building. Among the first people who took these QPR courses were the dispatch, who showed up at one of the very first events we had as part of the postvention. Between Amanda basically being in the police office, being in the station on a daily basis, and working on a couple of different safety and wellness groups internal to the town. HR has already, these are all authorized work hours. Nobody misses any, no town employee misses any salary for attending these. They're communicated internally with town staff through a couple of different messages. And then come September, so there's a new safety and wellness group that formed inside the town. And one of our recommendations is going to be maybe not mandatory, but incentivized participation in QPR for everybody. But it's a slow process. It needs to be something, we tend to sprint on Nantucket, and then someone gets a stitch or someone has to go and everything falls apart. So one of the things I want to do is make sure that this is a thing that is expected, and so will not rely on any single individual or entity or organization, basically.
It'd be just like learning CPR.
Exactly. That's the whole point.
And the great thing is it's 1 hour, so it doesn't take up a lot of time compared to other trainings.
Is this possible that it gets filmed and shown on our public television?
mean,
or if it-
Not an actual
NCTV.
training.
Fairwinds did that during the pandemic, is we
They were
did a
doing-
training and opened it up to the community, and then we taped it. And then was able to share it with people, and I think that is a great idea, because I think I fortunately wasn't at the Dreamland event, but I know people were able to zoom in and observe it or participate. And I was just thinking that's another way to get people that aren't able to leave their homes or,
I
you know.
think that would work. I think that would work as an outreach and communications effort, but the QPR is also a certification
Right.
program. So unless it's an there are gonna be restrictions on what QPR is gonna cover. We are absolutely gonna be trying to do a lot more videos and a lot more communication, but one of the things that I'm concerned about is over focusing on digital outreach
Right.
when we have troubles with we already the people who need this the most are not the people who are going to find it through a YouTube video. I don't think.
No.
Right. I mean, I think it should be available in all different venues, and I think some people, we're very accustomed to Zoom, and I think if we could, have an active training where people can zoom in, that's just as effective as having them
That's
there.
that's
And-
another way of reaching.
And Department of Public Health has a couple of webinar-based approaches to this.
Mhm.
When we started this up over the fall, I wanted to get the in-person more than anything else, because the options available to me when I was spinning this program up were, I needed to pick one and move with it to make sure we had something in September and October. When I'm meeting with Bree over the summer to get a bigger in first week of June, to get a bigger portfolio of what available services there are and different ways to deliver it. And webinar is gonna be one of them. This committee's council specifically had a child rearing during COVID, webinar. And so we have this as an outreach channel and a couple other different options as well. Just as a heads up, we are at 4:57.
Okay, I know. Tara, did you have a question?
No, but I have to leave at 5
Okay,
to get to the
okay.
airport, just to let you know.
Okay, thank you. Well, thank you for that update and it's a lot.
Yeah.
And I know that we have lots of questions and we could go on, but it is 4:57. So if we can move on to new business, and as part of new business is next month's meeting date. We wanted to move it from the typical fourth
20th.
Thursday to
The 13th.
June 13th. So I know that some have responded that they're not available to attend that day, but if that's a good day, we will make our next meeting for June on June 13th. And, okay, and at that meeting, we will have the consultants who have been doing the study, give us a high-level report, and we also will be looking at the charter. pardon me,
Oh, yeah, that's right.
the charter for Council for Human Services and how everything potentially is going to start coming together. So June 13th will be the next meeting. Any other new business? All right,
Motion to.
yes, if anyone can make a motion,
I'll make a motion to close the.
thank you. Can I have a second?
Second,
Okay, so with that, a roll call to adjourn. Tara,
aye.
Sarah,
Aye.
Sue,
Aye.
Kelly,
Aye.
Suzanne,
Aye.
Amanda,
Aye.
and Veronica, I. So thank you very much. That closes our meeting and happy Memorial Day to everybody.
Memorial Day.
And
Happy
bring on the
Memorial Day.
summer.
Yes.
Thank you.
Thanks, Veronica. Thanks,
Okay, thank
everyone.
you.
Thank you, everybody. Have a good
Speak soon.
day.
Take care.
Oh, and as always, if you have any questions on town stuff, call me.
Is done recording.
It will be in a brief second.
Okay.